How are brain tumor biopsies done? How are brain tumor biopsies done? This is a crucial question for anyone facing a potential brain tumor diagnosis. Brain tumor biopsies are essential for obtaining a tissue sample from a brain lesion. This sample helps doctors determine the type and nature of the tumor, which is vital for planning effective treatment. There are two main types of brain tumor biopsies: stereotactic biopsy, which is minimally invasive, and open biopsy, also known as craniotomy. The process begins with detailed imaging of the brain, typically using magnetic resonance imaging or computed tomography scans. These images help doctors precisely locate the tumor and guide the biopsy needle. To ensure accuracy, the patient's head is often positioned and fixed in a frame or with a fixation device. Markers may be placed on the scalp to assist navigation systems in mapping the brain and directing the biopsy needle accurately. In a stereotactic brain biopsy, a small patch of hair is shaved, and a small incision is made in the scalp. A tiny hole, about the size of a dime or quarter, is drilled into the skull to access the brain. Using imaging guidance and neuronavigation systems, which function like a GPS for the brain, a thin biopsy needle with a blunt tip is carefully inserted through the burr hole to the tumor site. The surgeon then obtains small tissue samples, which may be analyzed immediately to confirm adequate sampling. Afterward, the needle is withdrawn, and the dura, which is the brain's covering, along with the scalp incision, is closed and sutured. This procedure is usually done under general anesthesia, but in some cases, patients may remain awake if the tumor is near critical brain areas. This allows doctors to monitor neurological function during the biopsy. An open biopsy, or craniotomy, involves a larger surgical opening where a section of the skull bone is temporarily removed to expose the brain. This method is used when a larger tissue sample is needed or when there is a higher risk of bleeding. The surgeon can directly visualize the tumor and remove a sample. After the biopsy, the bone flap is replaced and the scalp is closed. In some cases, neuroendoscopy may be used to sample tumors located near the brain's fluid-filled spaces, known as ventricles. This technique involves using a thin tube with a camera and instruments to access the tumor. After the procedure, the tissue samples are sent to pathology for detailed analysis, which typically takes a few days. Depending on the procedure and the patient's condition, they may stay overnight in the hospital or be discharged the same day. Sutures are usually removed after about 10 to 14 days. While risks such as bleeding, infection, and potential neurological deficits exist, modern imaging and surgical techniques help minimize these risks. In summary, brain tumor biopsies involve carefully guided needle sampling through a small skull opening or a more extensive surgical approach. Advanced imaging and navigation technologies are used to safely obtain tissue for diagnosis while preserving brain function. This procedure is critical for confirming a brain cancer diagnosis and guiding effective treatment plans. Always consult with healthcare professionals for personalized medical advice.